Hey GP learners, one of the biggest challenges every practice has is their rota. I know for a fact my practice manager tears her hair out almost every single day about trying to figure it out, and finding something that can help you understand how your rota and everything works in terms of staffing from your practice to your network or even wider levels would be really nice. So I'm glad to introduce Dr. Ishani Patel and Jamie Griffin from Lantum, who are going to share with us their product that hopefully will save you a bit of time, some money, and definitely some stress. How are we doing, guys?
Doing great. Thank you so much for having us. We're excited to be here.
Great. Awesome. Thanks for having us.
Thank you. So Lantum does a lot of different things. I think it's probably better you guys introduce what you guys do, because more than I could probably say.
Sure, no problem. So Lantum's been around for a number of years now. And when we first started the company, we saw that there was a real need to connect newly qualified GPs to practices, because there was such a huge overspend from agencies and practices relying on recruitment and retention from using agencies. So the company first started off as a bit of a connecting platform. Mm-hmm. And then we were approached in 2012 by Tower Hamlets GP Care, who basically said, let's build a staff bank. Let's plug as many GPs as we can into this bank and help to permanently recruit to support both sessionals and substantive clinical staff. And so since 2012, so we're talking 8 years on now, the product, so both the bank and the Rota product that was built on top of it is now helping to support hundreds of practices and PCNs to staff their substantive clinicians and non-clinicians, so all types of staff, but also then to be able to find where the shifts are, where the gaps are, and be able to fill those shifts with a vetted local team of clinicians. And now we are in the world of PCNs. We have also expanded the product to include all the additional roles as well, mm-hmm. to support single sites and PCNs, hubs, and then federations, and then the wider integrated care systems to be able to look at their staff, know their workforce ecosystem, and then essentially mobilize them to where they need to be. So that's a whistle-stop summary of what the product does. But I think today we really want to show you things that you said that practices need, which are, mm-hmm. how can I make rostering simple? How can I overcome the pain points? How can I save time? How can I save money? And Jamie, our partnerships lead, will hopefully demonstrate all of those things.
Cool. So I think, Jamie, you're going to show us the product. Is that all right if we can start that up?
Yeah, absolutely. I'll share my screen now. Yeah, great. So yeah, as Ishani said, we work over many different levels, all the way from system-wide, like, for example, Greater Manchester, ICS, every single GP practice, all 500, has access to the Lantum platform, or we can work at GP Federation, PCN level, or even now single site level, which is what we're going to concentrate on today, and try and look at ways of helping with those pain points that each practice manager has when it comes to rotoring. So if we look at this page here, what are we looking at? This is a login for a practice manager that looks after 3 different practices. The 3 that we've got here are Dr. Gandalf's surgery, Ishani's surgery, and Jamie's surgery. And when the practice manager logs in, they'll be able to see a profile of every staff member in that shared bank across those 3 practices. So that's your salaried staff, substantive staff, sessional staff, anyone that's self-employed, any different types of staff that you would like to roster at your practice or say PCN level. So the examples we're looking at here today: GPs, practice nurses, AMPs, healthcare assistants, receptionists, clinical pharmacists. That's typically what we see across primary care organisations. Also things like paramedics and social prescribers, particularly with the PCN new types of staff as well. So there's no limit to the types of staff that you'll be able to have there.
I guess
we have over 40 different staff types at the moment, and we're always happy to add in more, because obviously as PCNs evolve and new roles like health coaches come, we're happy to expand it to whatever the practice or the primary care network needs.
Awesome. You answered my question before I got there.
So yeah, the idea is that each of these staff members would have signed up with Lantum through, say, a landing page that we create with your practice to say, okay, Dr. Gandalf's practice is now using Lantum. Please sign up here to create your account. And then usually we go through the first step, which is verification. Let's say, for example, if it's a GP signing up, verifying the GMC number. So Lantum will actually take the responsibility to check the GMC register to make sure that that all matches up. Once that's happened, we then go through our clinical governance process. So the CQC have told us that for sessional staff, we need to check a CV, a passport, and a DBS at the very least. If it is your salaried staff, you may want to say, okay, we don't need a CV being checked because they've been a partner for 40 years at our surgery, but we would like you to keep up to date with their DBS, maybe things like their basic life support or immunizations or whatever it is that each organisation would like to tell us, okay, Lantum, can you check these documents? Can you make sure that they're up to date? And can you alert both me and the clinician if they do run out of date? So the idea is that each staff member will have a profile that's visible by your rota management team. Let's have a look at an example. So we've got Dr. John One, who's a GP here. And when his profile loads up, we'll be able to see his GMC number at the top here, profiles, but a short profile about himself. Those documents that he's uploaded, so you know that if they appear here on the profile, they've been through the Lantum checking process and they are all legible, in date and valid. Things like IT systems, qualifications, extra language spoken. If they are a portfolio GP and they are working across the Lantum network, as we've set up about 150 different staff banks all over the country now, it will show you where else they've worked on the Lantum platform. So that could be at practice level or maybe at a UCC or extended access, wherever that might be.
Cool. You mentioned earlier about the notification that goes to the individual about, they've got their GMC registration, for example, about to expire. What kind of time frame does that come through? Does that come through a few days before, a week before, and can that be changed?
Yes, it can be. Generally, what we set is that, let's say, for example, your DBS is expiring in a year's time. So August 2021, your DBS is expiring. From a month before, so July 2021, you'll be notified through Lantum by notifications either on your app or by email to say you need to update your DBS, or you won't be able to actually book into sessions from the 1st of August at your practice. That will go on for a month of constant notifications. If it comes to a week, we tend to often give them a call, go through phone calls now, say, look, you really need to get this updated because you physically won't be able to be rostered at your practice as of next week. And then if it does go over that time limit, the rota manager will be notified and they won't be able to actually put them into any shifts from that time on.
So the pro screen, if it's live and everything's in date and everything's been checked, but it actually gets redded out if the expiry date, comes and they haven't uploaded their latest DBS, say, or safeguarding. Okay. So we've got that, and that is all automated. And the reason why we think a month is a reasonable time frame. We know clinicians are busy. A few days is not enough. We like to give people time and relevant nudges just to make sure that they stay compliant. And CQC is such a big thing for single sites and larger organisations. We've had actually a few clients where they've shown the Lantum platform during their CQC inspections to demonstrate their compliance. So we've had an informal thumbs up from the CQC, which is nice to hear.
Oh, right. So each of the staff will create their own profile. It might be that you want to say, okay, GPs, let's check these documents, practice nurses, these, HCAs, these, and then your non-clinical staff as well, your receptionists, you might want to say, okay, well, can you check their DBS, immunisations? Again, whatever standard you'd like us to check those documents to, we can do it.
And some organisations will have the minimum 3 or 4, and some will ask for 13. So it really does depend on the provider and what they want.
Okay, so we've got the staff sorted.
That's the staff sorted. Yeah. So how are we going to actually rota them? So let's click on rota at the top here. So again, we're looking at a practice manager that covers 3 practices. So at the very top, we have our list of sites here. We've got 3 sites. We can look at them all at once, or we can look at them one at a time. We'll do all at once for now. We've got our staff types here, so we've got all 6 staff types here. And now let's just look at GPs and practice nurses, an example. We have our people. So these are those staff types that are in our bank. So we've got our GPs and practice nurses. We've got a total of 19 of them. So again, we can choose to look at them all at a time, or we can just look at 1 or 2 of them on an individual basis. And the way that we're looking currently at the rota is not by place, by location, but by person. So firstly, I'm going to look by location, let's say. So show me my 3 locations and the period I'm looking for, let's say in a couple of weeks' time. So let's look at the 24th of August for a week's time, so 7 days. So this is broken down by that staff type. So at the top, we've got GPs, and then we've got our 3 surgeries that we manage, practice nurses, our 3 surgeries, and so on for each different staff type. So I think for now, I'm just going to look at GPs. So this is a typical week, let's say, for your 3 GP practices, specifically for the GP need that they have on their rotas. So at Dr. Gandalf's surgery, as an example, we need 5 days. For the first 5 days, we need 2 GPs a day covering this. Obviously, this will be a lot fuller. If we're a live one, we'd have multiple GPs a day. But let's say, for example, that this is your typical shift pattern. We need 10 GP shifts a week, so 2 a day for 5 days, and then 1 GP shift a week, Monday to Friday for the other surgeries, with a weekend appointment coming in at Jamie's surgery on Saturday. So we can see we've got a lot of yellow here. What we want to see is a lot of green. So green shows us that these are our filled shifts. So we can see, okay, Dr. 9 is working this shift at Dr. Gandalf's surgery on Thursday. Dr. 5 is doing a couple of shifts at Jamie's surgery on Tuesday and Wednesday. But the rest of them, apart from this orange one here, are vacant. So we know that we need to fill those shifts for GPs. So through the platform, it would be quite simple if we know who's working these shifts. And on Tuesday the 27th at Dr. Gandalf's, we'd be able to say, okay, well, we know who's working this shift. Let's go and assign them in to that shift. So here, this would pop up on the right. Firstly, it would ask you, is this a COVID response shift? That's something we've had to bring in over the last few months, but hopefully won't be staying around forever. And then you as a rota manager can say, okay, what's my location? Well, we know it's this surgery, Dr. Gandalf's surgery. What's my time and start date? This is the 9 to 5 shift. My staff type, I'm assigning a GP shift here. Hourly rate, that would only be used if you have a sessional staff member coming in, so somebody that works as a self-employed staff member. But if it is a substantive staff member, you wouldn't have an hourly rate in there. And then we have our options here to say, okay, well, which of my 12 rota staff do I want to assign this to on 27th of August? So let's assign this to one of my 12. Here's my list here. We can see we can't assign it to Jane 9 because it looks like she's already working at the surgery from 9 till 12, so she won't be able to take that shift. But any of my other 11 GPs are available. Let's assign that one to John 1. Any extra details that you want to put about the shift, any description, this will go through to John as well on his mobile app, and he'll be able to see, okay, the description of the shift has come through, there's telephone triage, there's free parking available on site, anything that you'd like to put in there. Anything else important, so there is PPE available for the shift, for example. This is a face-to-face patient shift, this isn't a work-from-home shift, and so on. And then any extra information that you want to put in there. These are all customized to each organization that we work with. So it might be that you want to say that this is going to be in room 1. We click fine, that's in room 1. And then we'd save that. And then we'll be told, okay, we're now moving a vacant shift to a filled shift with John 1. Do I want to notify the staff member? Yes, I do. And we're going to book that one in, and then that will change to green. John 1, he'll get a notification on his phone or on his desktop site to say, you are now rostered in for Thursday the 27th at Dr. Gandalf's surgery.
So the idea, I mean, obviously knowing that you've got some single site practices and PCNs who've got very low locum spend, very sort of confident with their recruitment and retention, and only really exclusively use their salaried staff. So this, you can pre-populate this and have it as your weekly template. So you can see all your shifts, you can see who in your staff is going to work those shifts. And then when it comes to, I don't know, summer holidays or partners going on leave, Christmas time, then you know where your gaps are to be able to use your I suppose sessional clinicians and administrators in your bank to then fill these shifts and share staff across multiple sites. Or you can just have the locums that you like to use as a single site in your single site bank and then draw on them as and when you need. So this tool was built out from feedback from practice managers and a range of practice managers, because some practices have a very high locum spend. We've had some clusters of practices who've saved anywhere from 100 to 200,000 pounds a year in locum spend. They've saved that money because they've used a staff bank with a very low subscription cost. Then you've got practice managers and rota coordinators who have saved anywhere from 4 to 13 hours a week, because so much of this can be automated. The instant booking feature, the priority access feature, being able to pre-populate your template before you advertise those sessions out to your bank. It's just saved so much time. No emails, fewer phone calls, not having to chase people. It's asynchronous, so people can use the app and check in, with their notifications when they want. People that opt not to have phone calls in the daytime can then just use the app and not have all the spam and all the stuff that's been associated with agencies. So it really is there to be tailored for what your practice needs. And this is, I guess, as an example of where you've got maybe a high locum spend practice. But for a lot of practices that don't really need sessional staff, you'd imagine a lot of this would already just be green, and you'd have a few amber labels. And
I think that element of being able to pre-populate the templates for the practices, like you said, they can stick in their regular staff and have a oversight view of what their staffing looks like, and then they can also then see, actually, this week in August we're looking quite tight because we've got 2-3 people off. Okay, we need to definitely prioritize getting somebody in to help us for that particular week, rather than the routine kind of stuff where they may generally be okay. So I guess one of the things I like about this as well is that cross-practice view, the sense that you can see various different places and have an idea that actually in this practice we're doing okay this week, but this practice are really struggling. And then is there that conversation potentially between the practices as well? Can we realign staff? That's potentially something I can see that may help networks in particular as we move forward. I guess there's this new concept of the GP chambers, or I know it's got another name, I think, hasn't it, Ishani, in terms of what's happening in the wider sphere with the people plan and that kind of stuff that potentially has real benefits for this.
Yeah, we were actually quite excited. We've written a summary on the NHS People's Plan. Happy to share that in the link if people are interested in reading a summary, because it's a long document. But we're really interested in using the platform to support basically PCNs having their own staff bank for flexible and substantive staff. We have looked at our data over the last 8+ years, and we have helped with continuity at a sort of macroscopic level, so helping local clinicians stay local, and therefore help that sort of community build aspect and people staying connected. We've also managed to improve recruitment, because obviously if you're staying close to a region and you're working across 4 to 5 sites within an ecosystem, you're building relationships, then great, a salary job comes up and you've already built the relationship, it's a no-brainer. And because we're not an agency, there's no fee, there's no finder's fee or cut from that. In fact, that's a win for us. And the most important angle is retention. So we've helped, we've got some data actually that looks at retention at ICS level and at federation level. So we are very much in the space of being that delivery partner to support people build their banks. We're now looking at how we can build in the education sort of network messaging features of those, because some of the value of a chambers model is that you get to connect with your peers on a regular basis and get your CPD and do case-based discussions and feel that you're not isolated. And certainly this platform has helped with the staff bank aspect. We've helped chambers to build that out. So yeah, we are excited. We definitely see ourselves as helping practices and PCNs get there.
And I guess so the main person I can see being the nub of this is going to be effectively the practice manager or the rota coordinator for the practice and stuff. Clearly for clinical staff, that there's a route that we can see here. How does it help with, I guess, the admin side of things? Because that's inevitably one of the other areas that finds real challenges. Can you explain how that looks? I think we sort of saw it with the people thing, with the people view, but I'd love to know how this can help, that problem.
Sure, yeah. Well, let's flick it back over to that people view and have a little think about time saving then. So if we were to have a look at the people view, the idea is that this would flag up to you where your vacant shifts are on a week by week basis. So across our 3 surgeries here, we can clearly see that on Monday the 24th, I've got 3 vacant shifts that I need to fill. So that would be the first alert that I see for GPs. And it would also show underneath it every single GP that's in my staff bank here and where they're working across my patch, be that either my one practice or say my PCN. So we'd be able to see that Dr. 5 is working at surgery, at Jamie's surgery on Tuesday and Wednesday, and Dr. 4 is over at Ishani surgery, but we need to fill in these 3 gaps here. So our options there are that we can just assign that to one of our normal staff or substantive staff, or I suppose we could say, well, out of my 13 GPs in here, I'm going to put the onus on the GPs and post this out to my sessional staff to say, okay, I do have a gap here, I need to fill it, I don't want to go to an agency, can I use the platform to post this out to my group of staff? So let's say, for example, on Tuesday the 25th, this is a vacant shift here, 9 to 5 at Dr. Gandalf's surgery. So this one, I've actually already now posted this out to my group of staff. So these are my 13 GPs that are in my bank. I'm going to flip over now to the GPs view so we can see what that looks like. So if we click here, can you see that okay?
Mm-hmm.
Great. So this is what they would see on the desktop site, and this is also what they see on the Android app or the Apple iOS app as well. So the doctor here, we were looking at Dr. John 1, he'd be able to see these are all the shifts that he's applicable to be able to apply for. So we can see, okay, Monday the 24th, we've got our surgeries here. These are the ones that he's able to apply for because he's a GP and because he has passed all of the relevant clinician checks that have been set by practice or by the PCN. So if he was interested in, say, Tuesday the 25th at Dr. Gandalf's surgery, he'd be able to say, okay, 9 to 12, £85 an hour. I am interested in that. Let's have a quick look at the details of there, see if there's anything else that my practice manager has put on. It's a mandatory training shift, so they put a label there saying mandatory training. Job description here, free parking, telephone triage, extra £30. If he would like to take that shift, pension also included in there, he'd be able to click apply and confirm his application. So the idea now is that would come through to our practice manager at Dr. Gandalf's surgery. And if we go and refresh here, now we should be able to see that there's been an application made on Tuesday the 25th of August. So we can see that's turned from a yellow shift to an orange shift. If we click in here and we review it, we know that we've got one application. If we had multiple applications, they all appear here. Dr. John 1's applied for the shift, and that's up to me as a practice manager to say, yes, I want to book them. Maybe we'll want to check the documents quickly. Have they got all of the documentation that I need? Yes, they do. Fine, let's book them in. And then that would change from a yellow shift to a green shift, so I know that that one's been filled for a day.
And they get the notification that their application's been approved.
Mm-hmm.
A couple of things on there. We encourage all clinicians, in fact all staff, to put their smart card numbers on there, because if you're going to be roving around multiple sites, you need to make sure you've got logins and all of those kind of all the accessibility stuff that the practice managers have to do. I'm an EMIS web practice myself, so I'm fully aware of all the stuff that my PM has to do in order to allow these roving kind of extended team members. So having smart card numbers makes such a difference. Mm-hmm. You asked a question about non-clinicians.
Yeah.
And I just want to come back to that. So Jamie, can we show what it's like for the view the receptionists? Because receptionists are the backbone of the practice. They are so important. Administrators, call handlers. The non-clinical team is it's the spine of the business. So I totally I hear PMs, managers worrying about, my gosh, what if I have someone that calls in sick? What am I going to do? Especially, I think the smaller practices where there's probably less resilience in workforce or more vulnerabilities there, which is why the PCN system fits, I think, really nicely, because you can actually draw on each other's colleagues without poaching or stealing, because there's so much transparency with it. So we've got federations in South East London, for example, that use it to rove all the receptionists across multiple sites. And the staff sharing is just great. And the learning through osmosis is great because they're saying, oh, hang on, this practice does it this way. I'll take that back to my practice and share. So share stories of success. And then you've got that kind of unintended QI happening between sites. So so here we've got a view. Jamie, do you want to what it could look like? Yeah,
that's right. So it would look exactly the same as it would for GPs in terms of the colour coding. We haven't got any reception shifts in there yet, but if I were to use the GPs as an example, if, like Ishani said, we wanted to move some people across from one site to the other, if we were to imagine that some of these were GPs, if it was the case that we did have too many staff on at one surgery and we've got a gap in the other surgery, it would just be a case of saying, okay, well, let's move this shift here from Ishani's surgery down to Jamie's surgery. We could drop that in there and we would say, okay, we're actually moving a shift here from one surgery to the other. Let's notify my GP or receptionist, or whoever it might be, to say, in good time, this has been changed and you're now working at a different surgery because we have too many vacancies there. So we would change and notify, and then again, they would get a notification in their own calendar view. So that links to their iPhone or Gmail calendar, Outlook calendar, whatever it might be, to say that this is where they're working. They would make sure that they were notified immediately when any changes are made, and 24 hours before the shift starts, that this is where they will be working for that shift.
And as an individual, I can set my availability. So as a receptionist, if I do 3 days a week, but I'm happy to do top-up sessions on a Friday, I can put my availability on the calendar. So that helps then the rota coordinator understand what their workforce pool is like at any one time, which has, again, we've had really, really good feedback, especially for weekend services, extended access and extended hours.
Definitely. And I think one of the things I like as well is that you can specify the rooms that people are sitting in. And I guess for practices as well, I mean, one of the biggest challenges we have aside from staffing and workload is obviously the estates and figuring out which rooms people go into. Have I got enough space? I mean, that's one of the key things I'm hearing loud and clear from my network workers, that many practices just don't have the physical rooms. So having a handle of which rooms potentially are spare, the fact that this seems to allow an element of that is quite useful, because hopefully it gives you that oversight look of, actually, I may have some space, so I could potentially bring in a network staff role here on this one day, and that from a network capacity I think could be really useful, because obviously we are going to have more roles coming through in the next couple of years or so, and that's going to be a real challenge, I think, to manage.
I think also with the digital first transformation that we know has been catalyzed because of COVID, the number of people working remotely, working off-site, working, let's say, asynchronously, or doing what traditionally would have been a day shift, maybe at night, for example, if they're processing online consultations. This also allows you to see how your staff are working. So for practices who are thinking about offering up an opportunity to work one day from home, or for people that would have been in 5 days a week, or for where shielded colleagues are fully working from home at the moment, you're able to have those labels as well. And that was one of the key things that we wanted to expand when COVID hit, was having greater transparency of how people are working, but also for those that are on site, we attach labels to do with PPE availability. Is there any expectation of face-to-face? Because that has been, obviously we've all been doing risk assessments, but we needed to make sure the tool aligned with the actions that practices had to take on the basis of those risk assessments. So again, greater transparency, which means then people feel more confident, especially when you're working in a practice that you don't know very well. If you can see, hang on, they've thought about my PPE, they've thought about where I'm going to be. If I am working remotely, then they've, all of these factors that play on our impressions of how we like a practice and how we feel safe. I think that those are so important at then recruitment. So that person will remember, hang on, 6 months ago during COVID, I did a shift here. I felt safe. They took all of this into account. I'm now looking for a salaried role. I'm going to go back. That sort of longer term thinking that people often don't have headspace to consider when it comes to pipelining workforce. I was wondering, because we didn't get a chance to show, Jamie, can we just show them what a landing page or a launch page could look like? Because you've got it up on your browser.
Up here, yeah. So we've been working closely with Newcastle GP Services for the last few months. It was firstly to set up their hot hub for COVID, but now that we're starting to get back to some sort of normality, we've got other things like their GP in A&E service, some out of hours as well, and hopefully their urgent care centres. So, for example, this is what we'd set up with each group that we work with, be that practice, PCN, Federation or ICS. We'd include all of their branding on there, powered by Lantum. This would be sent out to all the staff, substantive and sessional staff, so that they could create their Lantum account, selling the benefits of Lantum and selling the benefits of working with the organisation as well. So there'll be an easy way to click create your account, you become one of their staff bank members, and then you can be rostered on their platform as well.
Sure. And I guess the biggest thing I think potentially that I see with this is I know my practice manager has a billion jobs to do. You know, GPs say that they are overloaded and overworked. Trust me, our practice managers have it probably a hell of a lot worse at times. So I guess anything that saves them time, saves them stress, is always going to be a positive thing. Can you give us an idea of, I guess, you know, how much time you expect, you know, an average person to see a benefit from with using something like this?
Yeah, so we've done surveys and looked at data on time spent, and we've had a range. So some PMs have said that it saved them 4 hours, and some PMs and rota coordinators have said it saved them up to 13 hours. So I think it depends on the size, the number of services, and the complexity of how many clinicians, non-clinicians, and then numbers of those people. So I'd say, yeah, 4 to 13 hours saved per week, which even 4 hours is significant. That's almost half a working day, right?
So I was going to ask, is that per month? I was actually going to ask, is that per month?
Week.
But wow.
No, per week.
Okay.
And then
sounds pretty good.
Yeah, in terms of cost spend, I think Jamie's got some numbers that we can share.
Yeah, that's right. So recently, across a network of practices, four PCNs in North London, it was estimated that we were saving £2,400 a month just on locum and agency spend alone. So we're looking at around £30,000 per year across those 4 PCNs. And then, like Ishani said, the time saved is just massive. When you think about all of the time practice managers will spend with WhatsApp groups, phone calls, emails, going back and forth to make sure people know exactly where they need to be. Also, that resiliency that if the practice manager might be ill for one day, the idea that this is all cloud-based, the practice will have their own login, that the assistant practice manager, whoever's looking after the rota that day, will be able to log in and see exactly the same thing, get the same notifications, so be able to pick up exactly from where they left off. And then on the clinician side as well, they've got a diary, an app that shows them exactly where they're going to be. If there are any changes in their working week, they'll be notified immediately. They don't have to, again, call up the practice, make sure that they've checked exactly where they're going to work. This will all come through. So the idea is that we're trying to get rid of the idea of spreadsheets and then phone calls, WhatsApp groups, lots of kind of wasted time. So like you said, practice managers can get on with the million other things that they've got to do. And something else just to add as well about costing, in terms of how our fees work, there's a monthly subscription charge to use Lantum, and that's based on the number of sites that you use on Lantum. So if you use just Lantum for one practice, it will be this cost for 5 practices, this cost 20 practices, a large as well, and there's no other fees involved in the subscription fee.
Awesome. And I guess if people did want to look at the platform, you know, what we will put down right below that should be coming up right now is a little link that takes you straight to it, so you can have a little look and check it out and see what you think. It's not affiliated or anything like this, just simply a link that you guys can check out. And definitely, if you can't see that, then or can't access it, read or whatever, check them in the show notes. It'll be there, so you can just click on it and stuff and things. So thank you both. I think that's a really useful tool, and I guess I can clearly see the benefits, and I'm sure practice managers out there will be looking at this thinking, wow, 4 to 13 hours a week I could potentially save with my time. I'm going to have a look at this right now. Yeah. So
we actually haven't done a survey to look at the stress level saved, but hopefully we can infer that if you're saving time, you're then creating time for other things.
Well, I know for a fact that my deputy practice manager, one of the most stressful things that they both have to deal with is the rota. So anything that makes that easier surely has to be a win. And yeah, keen to see, I guess, what comes through with the platform as well. I guess the one thing that is potentially the holy grail is if this integrates with the clinical systems.
Hear it. You're not the first person.
No, well, and I say it's the holy grail because unfortunately, as we know, integration with clinical systems is with any kind of thing a challenge. But clearly, you know, if this integrated directly with System 1 and EMIS, wow, that would be heaven.
It's in discussion. So is it in discussion in terms of, as I'm sure people are aware, with tech companies, roadmaps are subject to change.
Mm-hmm.
And at the moment, we are focusing on the integrated care space and where this fits.
Yeah.
We are very much aware of the need for it to be able to interoperate with the EHRs, with the 3 EHRs. So we're in discussion. But yeah, we can keep you posted. We've got great comms that come out, so we can let you know kind of when we have more of a cemented plan. But we know it's very much on our radar.
Okay, so thank you both of you for your time. Really enjoyed this session, and hopefully, like I said, our EGP learners out there are seeing this and thinking, I can save 4 to 13 hours a week. Okay, I'm going to have a look at it right now. And definitely, if you've got any comments or questions, more than happy to try and answer them. As always, available on whichever platform you prefer, Facebook, Twitter, LinkedIn, yada, yada, yada. As always, definitely subscribe, click the bell, get notified of all of our content. And as always, EGP Learning is here to help save you and your patients time by tech enhancing your primary care and learning. Catch you next episode.